Does your loved one have a wound from radiation due to receiving radiation therapy from a cancer treatment? I'm here to help you. I'm Bienstock. I'm a board-certified plastic and reconstructive surgeon. My expertise is wound care in the home, and I'm here to help you and your loved one address a serious topic that I see in my practice. So it's not uncommon that people receive radiation therapy for cancer treatment after either surgery or pre-surgery. And what can happen is sometimes the skin can break down from radiation therapy for various reasons. Sometimes the dose of radiation is too high, or the skin is just susceptible to breakdown for various reasons. When you get a wound from radiation therapy, it's different than a typical wound, such as a pressure ulcer. So this is from radiation. The radiation can damage different layers of the skin, such as the epidermis and dermis, which can lead to an opening. This becomes very challenging to heal. We have to use good wound care techniques. Most of the time we try not to do debridement, since this can propagate further wound breakdown. The thing is that we have to keep it clean. We obviously have to stop the radiation therapy. I've had some patients where I'm trying to address the wound, and I still, radiation oncologist is still giving the patient radiation therapy with an open wound that's not healing. So obviously we have to address that. If the patient's on chemotherapy, we'd have to stop that, since chemotherapy has been known to hinder wound healing. So we have to focus on good wound healing techniques, get rid of any slough or necrotic tissue. We can use agents such as collagenase, or what we call Santal. In the worst case, we'll have to do a surgical debridement, and we have to do generally daily wound care to manage the wound bed to get it to heal. A lot of these wounds take a lot longer to heal. Now, some patients that have chronic wounds, we do oxygen therapy or hyperbaric oxygen. Those are generally contraindicated for various reasons when you have cancer and you're receiving radiation therapy. Sometimes you actually have to do a significant surgery if there's a big hole due to radiation injury. We have to debride that tissue and move tissue somewhere in the abdomen or the back to fill in that hole. And most of the patients I see, that doesn't happen. A lot of it requires just good wound care therapy, really hammering on the nutrition, as we talked about, high protein, and focusing on good clean techniques. As we had talked about, we don't want to use gels and ointments on draining wounds. We want to dry them out. On wounds that are too dry, we can use gels. A lot of my patients receive Silvadene from places like MD Anderson or Memorial Sloan Kettering, which are fine. It's not my favorite ointment, but it's fine because the silver in that will actually mitigate and curb microbials as well as bacteria. So if you have any questions or comments, please let them know. Make sure you subscribe to the channel, and I look forward to our next episode. Thank you.